And it's just a huge honor for me today to be podcast interviewing Frank Catalanotto, DMD, Professor, Department of Community Dentistry and Behavior. Frank is a recovering pediatric dentist, former president of the American Dental Education Association, former dean of University of Florida College of Dentistry, and current professor there. He has devoted most of the past 12 years to access to care issues. He is a passionate believer in the value of adding dental therapy to the oral health care team. He believes that dental therapists are good for both patients and dentists. So, Frank, with your last name, Catalanotto, I have to ask you, are you Italian, or Sicilian?
I am of Italian descent, and my parents were born in Sicily, and my mother's parents were born in Naples.
Is that right? Naples, Florida, or Naples?
Naples, Italy.
Naples, Italy. Wow. And I also have to ask you, since this is Dentistry Uncensored, a lot of Italians were offended by the movie, the HBO series The Sopranos. Did that bother you?
Not at all. It was a TV show, and there were plenty of TV shows about other ethnic groups that have had bad criminal involvement. So no, I wasn't offended by that at all.
And I tell everyone that not everyone can be perfect like the Irish.
That's probably very true. I'm married to a wonderful woman of Irish descent.
Oh, right.
One thing I need to say that I wish you had not mentioned my university affiliation. So I have to say that the views I express are my own and do not reflect the official views of the University of Florida.
Yeah, Roger, and the reason I'm so honored that you accepted my invitation to come on the show is because you are for something that is so many dentists are just so fearful of, and they just think it's the downfall of dentistry. And I've seen this rodeo before. I've been a dentist 30 years, and I remember when hygienists were trying to get independent practice, and it passed in Colorado, and all of like 7 hygienists did it, but you would have thought the sky was falling. And now I see this rodeo again with dental therapists. What are your thoughts on it? You must know it's controversial to the American Dental Association and to organized dentistry and to dentists.
So it is very controversial, but let me also state that we believe the opposition is coming primarily from leadership. We participated in a poll through the NIH-funded practice-based research network, which reaches out to about 1,500 dentists across the country who allow their offices to be used for clinical research. And in that poll, 48% of them thought that dental therapy sounded just fine. So I think there is fear-mongering going on by the leadership of organized dentistry. Maybe it's a ploy to try and increase membership to show that they're fighting for dentists. But the truth is, dental therapy is great for patients, but it's also great for dentists, as we're seeing in Minnesota.
Well, explain what is. I mean, I'm sure there's dentists, and about 20 podcasters are young, so probably 25% are still in school. The vast majority under 30. We're probably the 2 oldest guys that ever listened to a podcast in dentistry. Explain what it is.
So dental therapy is just another member of the oral health care professional team. They are trained. The educational requirements in the United States by the Commission on Dental Accreditation are 3 years of education. And during that education, they are taught how to do restorations. They are taught how to do prevention. They get significant training in motivational interviewing to change patients' behavior. They can actually extract teeth also. They can extract primary teeth and permanent teeth that are very mobile. I have a mobility factor of at least 3. They work under the general supervision of a dentist, which means that they can work in the office when the dentist is there, or they can work out of the office, or in the office when the dentist is not there. And they have been in use in 54 countries around the world for up to 100 years. And in the United States, they are up and running in Alaska and Minnesota. Legislation has passed in Vermont and Maine. Vermont will start their first educational program this fall. And there's legislation pending in about 12 other states, including your state of Arizona.
And you're flying to Phoenix next Wednesday to testify Thursday.
To testify Thursday morning in front of one of the committees. I forget whether it's the House or the Senate. And I do a lot of this for both the Pew Trust and the Kellogg Foundation, which are the two national foundations that are promoting dental therapy.
Pew Trust and the Kellogg Foundation. Can you tell us what are those? Tell us the story.
The Kellogg Foundation actually comes out of the Kellogg Breakfast Cereal Corporation, and it was founded many years ago by Mr. Kellogg, the original founder of the company. And they're very interesting because their mission focuses on social justice and racial equity and correcting healthcare disparities. And that's why they got into this dental therapy business.
So, social justice, what were there to?
Social justice and racial equity with a focus on healthcare disparities. And so that's why they were the first foundation in helping support the effort in Alaska, and they work in a couple of other states in the country. The Pew Trust, on the other hand, is very different, but with the same goal. So the Pew Trust is driven very much by data and evidence. So they look for evidence-based policy solutions to a variety of problems. It could be education, it could be the environment, and it could be healthcare. And they have been in the dental care business for about 10 years. They have supported community water fluoridation. They were big proponents of school-based sealants. And then they have moved a significant amount of their efforts towards dental therapy because they believe the printed, published evidence that dental therapists are safe, can do high-quality dentistry, and can be effective in improving access, particularly for poor people, but quite honestly for all people.
Well, maybe it's just my perception, but it seems like every time I see something about Pew Trust, it's about the oceans, the trash in the oceans, the overfishing of the oceans. To me, it seems like they're really big into the oceans.
So that's what you hear about if you listen to National Public Radio. You'll probably hear the Pew Trust referred to 10 times during a day. But they cover a wide variety of areas. It's way more than the environment. Again, as I said, it can be education, it can be poverty, it can be healthcare, more global health issues, and they saw dental health as an area where they could make a real impact. That's how they choose to make their decisions. And the dental team in Washington at Pew headquarters is about 15 people. They devote a lot of effort to this activity.
When you said the therapist, 3 years of education, is that 3 years out of high school, 3 years, or is it like hygiene school, which is 2 years, but they have to do 2 years?
So it's 2 years after high school, basically. And if you are already a dental hygienist or, let's say, an expanded function dental assistant, you can get some prior credit, so you could probably get the training in about a year and a half. The Alaska program, just to clarify, is 2 full calendar years, but the CODA standards are 3 academic years. So 6 semesters spread over 3 years. That's why Alaska can do it in 2 years, because they go full time. And yes, it's post high school. They're very analogous to physician's assistants. The difference is that a physician assistant has to have a bachelor's degree first. But the total clinical training for a physician assistant is no more than 2 years. In some states, 3 years in another. Very analogous to what a dental therapist can do. And if you look at the skill set of the physician assistant, they're doing, I should say, one of the scare terms used by dentists in opposing dental therapy is irreversible surgical procedures. That means cutting a cavity in a tooth, Howard, or extracting a tooth. Well, you ought to look at the list of irreversible surgical procedures that a physician's assistant can do with just 2 to 3 years of education. It's enormous. Bone marrow biopsy samples, a variety of things like that are certainly irreversible surgical procedures. So it's a scare tactic. You have to look at the evidence. One of the things I say to opponents, I look them right in the eye and I say this: I understand how you feel, but can you show me any evidence to support your fear or your concern about the quality and safety of what they do? And then I just sit back and be quiet, because I know what the answer is. No, there is no evidence to support Howard, even the American Dental Association, Council on Scientific Affairs, said that the quality of work done by a dental therapist is equal to that of a dentist. And they reviewed all the literature at the time of their report. And every report that we're getting now out of Alaska and Minnesota shows safety, quality, and effectiveness in improving access for underserved people.
Well, you know, this, again, you and I remember Bob Barkley. Do you remember Bob Barkley?
Yes. Yeah, I do.
And he was the first dentist. By the way, we got a VCR tape from him, from Omar Reed. I kept telling my listeners I feel so sorry for so many of the most important people in dental history that never got digitized and made it to YouTube because they're gone. So I was asking my listeners, if you have any old tapes that some of these legends, and Omar Reed found a VCR tape of Bob Barkley, and of course I don't have a VCR player, but Ryan's going to take it to a place and make it digital, and we're going to put it up. We're going to load it up on YouTube because when he was going around the country, he was trying to promote dental hygienist, and it was the same mechanism. People were like, "Well, first of all, who's got time for that? I'm booked out 2 months in advance doing immediate dentures, and you want me to do this?" And he had to look at me in the eyes and said, "Do you want your granddaughter to have an immediate denture? You know, this hygienist is going to try to prevent." And then I saw, and then he went down in a plane crash, kind of up, when is it, up by Minnesota or something? A lot of amazing rock stars and dentists went down early in a plane crash. And then when expanded duty function assistance came out, it was the same thing. This was going to destroy dentistry. But and Arizona just passed that.
Even dental hygienists, they're still fighting, allowing them to do what they're trained and able to do. Now, if you look at the Southeast United States in terms of the issue of general supervision of dental hygienists, the Southeast United States is a black hole. And in Florida, we only 3 years ago, got general supervision of dental hygienists allowed. Only 2 years ago did we get the ability of dental hygienists to do local anesthesia. I mean, if it's safe in all these other states, why isn't it safe in Florida or Mississippi or Alabama? I constantly hear about struggles in those states to help improve access by expanded scope for dental hygienists and the resistance that occurs. It's very disappointing of my profession.
I think one of the most disappointing those are the professions that a hygienist has 4 years of college in the healthcare arena. She'd be a registered nurse, or he'd be a registered nurse. Yet they're not allowed to give flu shots or HPV vaccines. Either is the doctor of dental surgery. That blows my mind. I mean HPV. Australia is the first country on earth to declare that their HPV is gone, that their vaccination program, I think they declared it with, what was it, cervical cancer or uterine cancer, and to see the onslaught rising of oral pharyngeal cancer and to see all these hygienists and dentists handcuffed behind their back, yet I could walk over to Walgreens or CVC and get a flu shot by someone with 9 months of training, yet my hygienist is talking to grandma and grandpa about gingivitis, and in the next 6 months, or when she sees them again after the flu season, 8,000 to 38,000 Americans will die from the flu. And why are you looking for gingivitis when the flu season? And in fact, we even had a dentist on Dental Town, a dentist, I think it was in Alabama, died this year of the flu. And he was a total class act, a healthy guy. I mean, this is just not who you would think would die from the flu. And so it blows my mind. And when you talk about access to care, I believe Tennessee is the first state to allow hygienists or dentists. You got to be a doctor of dental surgery to keep up with the pharmacy tech at Walgreens. I can't believe that it's just not standard of care that dentists are given the flu shot and the HPV vaccine. They say it needs to be in the child by 12, and I guess if you catch HPV, 99% of it the body takes care of, but if it does turn into a neoplasm, it's about 8 years later, and that's high. That should be very high on the agenda for dentistry.
Well, you know, the HPV is a really interesting case. So I do some work with colleagues at the University of South Florida on trying to get dentists more motivated to counsel patients about HPV, not even giving the vaccine, but and it's very, very difficult because it's a very touchy area and a very sensitive area to talk to parents of children about a disease that's transmitted by sexual behavior and unsafe sexual behavior, and the need to get the vaccine, whether it be by the dentist at some point in the future or by the physician. But dentists are reluctant to do that, is what the research has been finding. And that's part of the attitude that we've got to change. I mean, dentists have to learn to start to recognize that we're part of a healthcare system and a healthcare team. And we can't keep this isolationist silo mentality that we have right now. You look at the data coming out from the insurance companies and others about the relationship between periodontal disease and diabetes and cardiovascular disease. It's pretty unequivocal at this point about that relationship. And we need to do a better job of talking to our medical colleagues and educating them. They need to understand this better, but we're not alone in this health business. If we are, we might as well, maybe we should just be a cosmetologist or something. But oral health is health, and dentists need to realize that and do everything we can as a profession to help people get better access. And it's hard because, according to the ADA, cost is the major factor that keeps patients away. And I want to go back to dental therapists. That's what dental therapists can do. They can help reduce the cost of delivering care to patients. And they're doing that in Minnesota today for all patients. In Alaska, it's limited to the Native American indigenous folks of Alaska. But in Minnesota, they are in private practices, they are in FQHCs, they are in hospitals, they're in for-profit corporate groups, they are in not-for-profit corporate groups, delivering care across the state.
Who was the executive director of the ADA back in the day? I think he served like 10 years.
Harold Hildebrand. There's a quote that I use from him that...
How do you spell his name?
From the 70s. And he was one of the most respected executive directors of the ADA.
What was his last name?
Harold Hildebrand. And his quote, I'm going to have to paraphrase it for you, was that the New Zealand Dental Nurse Program, which was being tried out in Kentucky and Massachusetts, was probably the best thing that could happen to American children in the history of dentistry. And yet, his association, the American Dental Association, stopped those studies at the Forsyth Dental Center, and I forget where it was in Kentucky. Stopped it cold.
And why do you think that was?
Again, it's fear. It's fear, and look, we dentists have had a monopoly on healthcare, an absolute monopoly on healthcare. The truth is, we control who gets on state boards of dentistry. The PAC money helps control legislative control of the monopoly. But when we're leaving 190 million people in the United States without access to dental care last year, this has got to stop. We have to be part of solutions. We can't stand there and be opposing everything. I could give you so many examples. When I arrived at the University of Florida in 1995, one of the first things I wanted to do was get our dental students out of the building in Gainesville to work in FQHCs, working alongside dentists in FQHCs. And the Florida Dental Association tried to stop me from doing this. It was going to cause competition for dentists. 80 dental students spending 6 weeks in community-based sites. Please, give me a break. That's not going to cause competition for dental care. And they tried to stop this. And the only way they were stopped in what they were doing was the president of the university and the vice president stood by me 100%, and then the Federal Trade Commission came in and stopped the Dental Association from stopping our dental school from opening up these community-based sites with our students. I mean, that attitude just has to stop. when 191 million people didn't get care. It has to stop when 100 people have died in the last decade for a preventable dental infection. When last year in Florida, 166,000 visits to hospital emergency departments for a preventable dental problem. Also, a profession can have a monopoly? No, I don't think so.
Well,
that's not going to.
Well, you know, it's interesting because I'm in Phoenix, Arizona, where the city's about 1 million, but the metro's 3.8 million. And on Sunday, if you get hit by a car and break your leg, the ambulance is there. They take you to a fully staffed 24-hour-day hospital. But if you broke your tooth, you're completely out of luck on a Sunday. I mean, there's not the access to care. Saturdays and Sundays in almost every town in America is almost zilch.
Yeah. And what you have to do is then go to a hospital emergency room, and for roughly about $1,000 to $1,500, depending on the city and state, you're going to be given some pain medication and an antibiotic, and you're going to be told to go see a dentist tomorrow. No, again, that doesn't work. If you couldn't find or afford a dentist today, you're not going to find or afford one tomorrow. And so this system of high costs, and I will also admit poor oral health literacy for many in the public, it's not just costs, has to stop. And there are lots of solutions for this. The American Dental Association has proposed this community dental health coordinator, and I can see how they can work for safety net settings. I still don't understand how they'll work in private practice, but they are basically patient navigators, helping drive patients to go seek dental care. But they still don't affect the issue of cost, and dental therapists do.
You know, the independent practicing hygienists, I believe there's only like 7 in all of Colorado. Right. The dentists, when I lecture out there, the dentists love it because she's in some small town of 1,000. She didn't go buy land and building and start a dental office. She just take her dining room table out and put a dental chair, and she does the hygiene, and then when she sees something, she writes a referral, and then that patient drives to the next bigger town. Those dentists love it. They're sending her cookies and cupcakes and for her referrals. It's kind of amazing. And I also, when Arizona just passed the expanded duty function assistant, which almost made me 30 years ago go back home to Wichita, Kansas, instead of Arizona, because the dentists in Kansas loved it. They would they'd have 3 chairs of opera to go, and they'd numb, drill, and then the ADFAs would do it. And I would always say to them, well, do you think they do a good job? And you know what they'd say to me? Are you kidding me? They do it better because they get a block off an hour for 1 filling. I would be in there trying to rush 3 fillings in 1 hour, and since they take the time, it looks like a piece of artwork. And so my buddies back in Kansas said the expanded duty function assistants are actually better. And I'm starting to wonder if the majority of these dental therapists will actually end up working in dental offices. So the hygienist is doing the cleaning, which the dentist doesn't want to do. And the dental therapist could be doing the operative, which the dentist really doesn't want to do. I mean, come on. After you've done 10,000 fillings, do you really want to do another filling? Do you really want to do another cleaning? Do you see that?
Let me tell you about the experiences in Minnesota. So remember, this is the state where the Dental Association vigorously opposed dental therapy. So they had roughly 80 graduates of the dental therapy programs in Minnesota. I believe it's about 25 or so of the therapists are now working in private practices. Okay? The private practices are doing a social good because at least 50% of the therapist patients have to be Medicaid. But you know what else is happening? Exactly what you just said. The dentists are actually making a higher profit on their practice. Why? They're not making it off the sweat of the brow of the therapist. They're making it because the therapist is doing the less dollar-producing simple restorations, and the dentist is now free to work at the top of his or her scope of practice. That means crowns, that means dentures, that means bridges, that means implants, that means cosmetic dentistry, all the things that are more high-end. So in Minnesota, we're having a social good, more Medicaid patients being seen. We're having happier dentists. And in particular, We have educational tours in Minnesota where we bring people in to see dental therapy in action. And the speaker at the ending speaker at the last meeting was a rural dentist, a young dentist working in a rural part of Minnesota where he has no specialist to refer to. What is he doing? He now has 2 dental therapists in his office. He's flying around the country to CE courses, learning new skills. He is practicing at the top of his scope of practice. His therapists are doing the routine work. Now, in Minnesota, a lot of them are dual trained, so they're both a hygienist and a therapist. So they're doing essentially what you said, and they are working in Minnesota. They are seeing Medicaid patients. They are helping the dentist expand their practices, and the dentist is working at the top of his or her scope.
And in Minnesota, what is the equivalent pay of like a dental assistant versus an expanded duty function assistant versus a hygienist versus a dental therapist?
So it's from what I understand, it's a little more than a dental hygienist. So it's in the vicinity of about $60,000. But for a new dentist going out into practice, the starting salary might be $120 to $130. And if they're going to work for an FQHC, for example, a safety net clinic, that means that they can hire 2 therapists for the price of 1 dentist and expand their reach. And the other way they work in FQHCs and safety net situations is they take portable equipment and go out to schools. They go out to nursing homes. There's a wonderful case study that I can share with you. Apple Tree Dental, a famous not-for-profit, I'm sure you've heard about them in Minnesota. Mike Hegelson is the CEO of that organization. They send their dental therapists to a VA nursing home to provide dental care to those patients, and they can take care of about 70% of the oral health needs of fragile nursing home patients safely and effectively. Think about that. They can go into schools. Instead of asking mom or dad, who's in that hourly job at Walmart or McDonald's, to take time off to bring the child to the dentist, they can get their dental care in the schools as part of the school day. What a great way to bring care to people who need it.
So you're a pediatric dentist, and you're coming to Arizona, where we have one of the most famous pediatric dentists on earth, Jeanette McLean, with her was doing silver diamine fluoride. She made the New York Times, but that is probably the only controversy amongst pediatric dentists. Some love it, some tried it, don't care for it. Jeanette McLean loves it. What is your views on that?
So I think silver diamine fluoride is wonderful. It has lots of applications and uses. I'm not in practice anymore, so I don't want to mislead anybody. But from my conversations with people in the pediatric dentistry department, with other folks in my department who have studied and researched this and talk about it, it is very good and very effective. There's a couple of pediatric dentists in Florida who have been using it right from the beginning. You may know the distributor is actually Elevate Oral Health in southeast Florida. And they are saying it's significantly cutting down. They're going to the operating room. It's even significantly cutting down on their sedation cases, and they're able to hold those kids until they're a more manageable age. So based on everything I have seen and read and people I've spoken to, I think it is another great tool. Is it the only solution? Of course not. Just like dental therapists are not the only solution to helping people. But yeah, I think it's absolutely terrific.
The New York Times also did an article. You said Apple Tree Dental, so on Twitter they're at Apple Tree Dental, and I'm retweeting their last 2 tweets so my homies listening can find these guys. But they also had retweeted how dental inequality hurts Americans as printed in the New York Times. Did you see that article?
Yes, I did.
What were your thoughts on that article?
Well, my thoughts are it's absolutely correct. We should not have this inequality. We should not have one group of haves and one group of have-nots. Everyone deserves access to quality health care, and very specifically dental care, because, and again, I'll just give you a couple of examples, okay? We now have 5 or 6 published studies that show that kids with poor oral health don't perform as well in school. And, and my response to that is, how do you get out of poverty if you're poor? You get out of poverty by education and hard work. And if 1 in 5 kids in a town has a toothache, how are those kids going to learn? Well, I think inequality is bad, and it perpetuates more inequality as one gets older. So I am all for any kind of evidence-based solutions that can improve access to health care and quality dental care.
The American Dental Association, you got to give it to them. They got the who would you say the best quarterback in the NFL is? It's who's that guy for the Patriots?
Yeah.
What's his name?
I'm blocking on it. My wife would know immediately. She loves it.
But I mean, they got their economist Marco Vujicic. I mean, he was from the World Health Organization. He was from Brussels. I mean, this is the most. This might be the #1 healthcare economist in the world.
Marco is absolutely terrific. I have met him personally and know him. I think he's absolutely terrific.
Because what I love about economists is they never have a dog in the fight. They're emotionalists. I mean, they make accountants look emotional.
Yeah.
They just look at the number. They don't talk about woulda, shoulda, coulda, right and wrong. They just say this is it. And he talks a lot. His last article in JADA, our dental care system.
Great piece, his last article.
What's that?
Really, it was really a great piece, his last article.
Yeah, we'll talk about it, and Mark, because if you want to argue with Marco, he's going to show you data from 50 different countries. I mean, this guy knows the economic research. Tell him about Marco and this article. What you think of his article and Marco?
Well, so, I mean, one of the things that he says is that compared to a lot of other countries, cost is the major factor that is keeping folks from dental care in the United States. So one of his fundamental premises is that we need to expand access in this country by whatever way we can do it. And that's one of his 4 recommendations. One of his other recommendations is that we need to become part of the healthcare system. We cannot stand in isolation as a profession. And he has said this in numerous pieces over the last number of years that he has been working for the American Dental Association. One of the things he said is that we've got to have better metrics. We've got to have better ways to measure what we do. And again, I'm going to point out another negative here. But what has prevented us from getting good measures and outcome measures in dentistry is the lack of diagnostic codes. And who has been the opponent of diagnostic codes for all but the last couple of years? And that's the American Dental Association. All right? And then the 4th thing that he says is that we've got to change how we deliver care so that all members of the team are practicing at the top of their scope of practice. Now, he did not say dental therapists in that 4th recommendation, but I can read dental therapy right in that. So we've got the dentist, we've got the dental therapist, we've got the dental hygienist, we've got the expanded function dental assistant, all working at the top of their scope of practice. We have got to reform the healthcare delivery system, and that was his 4th message in that most recent article.
Well, one of the strangest things about dentistry and why a lot of people think a dentist isn't a doctor, like when people have told me several times in the last 50 years, well, a dentist, that's not a real doctor. I always say, well, Dr. Pepper wasn't a real doctor, and neither was Dr. Dre or Dr. Seuss. But, urban legend has it that the medical schools wanted beds and that they actually started dental schools simply because they wanted chairs. Dr. John M. Harris started the world's first dental school in Bainbridge, Ohio, and helped to establish dentistry as a health profession. It opened on 21st February 1828, and today is a dental museum. The first dental college was Baltimore College of Dental Surgery, which opened in 1840. The reason I don't like the separation of dentistry and MD program is because when you go to other systems like the old Soviet Union system, dentistry is all surgery. You work in an operatory, and I noticed that in the Soviet era, back when I got out of school, if a dentist say he lost the ability to say he lost an eye and now he has 2D, or he lost a hand, or she was injured, she could just immediately go be a physician because
Yes.
lots of probably half of all physicians never do eye hand surgery. They're mostly running tests and talking to patients. So
Sure.
those disabled dentists can go be dermatologist or do a residency in something else immediately. Whereas dentists, if you can't do dentistry anymore, you literally got to start back at square one to go
Yeah.
be a dermatologist.
Become a consultant for an insurance company or an expert in malpractice cases. But you're right. There's not a lot that you can really do. But it's not just Russia that you mentioned. Most of Europe traditionally had a system that was medically based for dentistry. You became a physician first, and then you went on to dental care. Now that has changed drastically over the last 20 or 30 years, and it's much more like our Western system where we are separate. Um, I don't have a big problem concern about the separation of the education. My problem stems from the separation of the practice. And why wasn't dentistry in Medicare in the '60s when Medicare started? Opposition of the American Dental Association, and now we're left out of it. And people start to retire at 65. They had dental insurance, and they find out there's no dental insurance in Medicare. Now, I'm happy to see that there is an effort going on nationally, and the American Dental Association is part of that effort to try and bring a dental benefit into Medicare. That really pleases me, and I'm proud of the profession for being part of that activity.
You know, um, Vucic is my favorite, one of my top favorite economists, but my other one, and maybe my most favorite, I shouldn't say that, I don't want to get back to Vucic, but if there's anyone that he competes with, it's got to be Dr. Regina Hertzlinger, doctorate of business administration, healthcare economist, Harvard University. And she makes a valid point that one of the biggest problems with Medicare, Medicaid, is that they say this is the fee and this is the only fee you can take. So then you have access to care issues because a lot of doctors aren't making a low cost Chevy, they're making a little more expensive Pontiac or Buick or Olds or Cadillac. And like everyone would take Medicaid or Medicare if they came in your office and said, okay, well, Medicare will pay $75 for this filling, but we charge $150. Here's the list of all 6,000 dentists in Arizona. The ones with stars by them will take his fee, but humans are capable of making very complex business decisions. They purchase cars, and there's a variety of price points. But it's kind of like government says, "Oh no, if you're poor, you can only have a used car." And when they raise their hand and say, "Well, can I apply that used car for a brand new Chevy?" It's the answer is no. And Delta goes to great deals. Like if you go out of network, they'll stop mailing the money to the dentist. They'll start
Yeah.
mailing it to the patient, just knowing that that will go south, and a lot of them will cash the check and spend it. So to me, it takes out innovation. It takes out the poor people's ability to decipher, I'm going to cut back spending on eating out at restaurants or other discretionary incomes to get a better, more expensive filling. Maybe this guy does a tooth colored and the Medicaid clinic does an amalgam. Why? So it seems like it has more to do with power and control instead of subsidizing your consumer choice to go out there and buy what you're intelligent enough to make your own decision.
Now, I don't know enough about the background of what you were just saying, but I mean, it's very clear to me that Medicaid fees are low because it's not a priority within state governments where Medicaid decisions are made. I mean, thank heavens that it's mandated for children by the feds because they play a large portion of that. And in many states, we don't have an adult benefit. And I don't see, and certainly in this political world, I don't see any opportunity that we're going to be able to raise Medicaid fees. Medicare, on the other hand, I think is a different situation. So, Medicare does work hard to find innovative solutions. And I remember my eye doctor saying to me, he said, Frank, I may not be happy with the dollar amount I'm receiving for your eye visit, but I know the check's going to be there next week with very little paperwork. I mean, that's one of the beauties of Medicare. The least costly insurance company in the United States in terms of administrative overhead. It's simple to use. And I think that's one of the things that I liked about the Affordable Care Act, to be quite honest with you, was an approach towards more innovation, controlling costs. It had its flaws, and I certainly recognize that. But it was a start at dealing with this issue. And we spend more per capita in this country, twice as much as the next closest country. And we have health outcomes that rank in the 20s. Why is that? Our system is out of control. It's driven by the wrong incentives. It's not driven by keeping you and I healthy. Imagine if a dentist were under pressure to keep my mouth healthy with me in partnership, what that might do. If I got paid, as some programs now do in the Northwest and in Minnesota, if I got paid partially on the procedures that I do, but also on my patients' health outcomes. And that's one of the, I didn't mention that when I mentioned Marco's most recent paper. That was one of his issues. We've got to change the incentive system.
Well, back to well, first of all, in the Affordable Health Care Act, I thought it was extremely bizarre that they rolled it out at the state level Medicaid as opposed to the Medicare, because like when I saw so many people in Arizona in my practice that were against Obamacare, I'd say, well, right here on your chart, you have access, you're pregnant, you're a woman, you're unemployed, and who's paying for all your prenatal care? And they say, well, that's access. And I say, well, that's the Affordable Health Care Act. That's Obamacare. So you want all that taken away? And she'd say, no, not at all. And I said, well, you just told me you hate Obamacare and you don't think they should. So the branding, I mean, for as far as business, I mean, all these people in 50 different states getting these benefits under 50 different names is my opinion. Half of them didn't even know that was Obamacare or the Affordable Health Care. But back to subsidies again. When the federal government subsidizes corn farmers for ethanol, whatever, they don't set the price. They don't say, oh, we're going to give you corn subsidies. You have to sell your corn at $1 a bushel. Then 2/3 of the farmers say, well, I can't do this. But that's what they do with health care. They say, well, here's Medicaid. Here's a subsidy for a cleaning, filling exam, and x-ray from Medicaid for the poor, and Medicare doesn't cover it for the elderly. But that's not what they do. They say, here's a subsidy, and we're going to set the price. And historically, whenever a city, like the greatest city in America, New York City, they had an era where they, for make apartments affordable, they started setting rent prices. So what did they do? They stopped all rental construction. It was a disaster. And all the economists agree that when you set the price, you kill the industry. And I think the Medicaid, I mean, California had a deal where they raised the prices of their Medicaid for dentistry, and they were shocked that a whole bunch more dentists took it. And it's like, well, if you just, said it's a subsidy, well, everyone would take it. But again, they're still set on 1970s rent control policy. And one other thing I want to say about another policy that I think is very misguided, and that is I'm from Kansas. And when you go to Kansas, Ohio, Nebraska, North and South Dakota, 10% of the counties don't even have a dentist. And they don't realize that the deans are still filling the class based on if you got straight A's in math and geometry and calculus and physics, which I've never used once in my 30 years of being a dentist. But if you want a kid to go to that farm town of 5,000, guess what you got to do? You got to accept a kid from that town of 5,000. You can't accept a kid from Kansas City and then be shocked when he doesn't go to the small town in western Kansas. But that kid in western Kansas doesn't get in because he didn't have A's in geometry.
we have sort of figured that out in dental education, thanks to the leadership of the American Dental Education Association. And most admissions processes at most dental schools today use a holistic admissions process where it's not just grades. So they're trying to get that rural kid as well as the inner city applicant. They're trying to get diversity in the applicant pool and the graduates of dental schools. We've got a long way to go. We're not yet approaching what I'll call equity within reflecting the population in this country, but we're getting a lot better at it than we used to.
Do you think they are? Do you think the schools are?
Dental therapy that's so interesting. So, in dental therapy, Alaska, I'll start with that as an example. You got to understand the cultural issues in Alaska of the Native American people. And they recruit dental therapy students from these remote populations. And what do they do when they graduate? They go back. All right? Or they'll work in a hub city like Bethel, which is not a big town, but it's got one or two paved roads and an airport. And I've been there. They fly out on Monday mornings to the remote village of 400 people. Hours away, you can only get there by plane. And what we're seeing in Minnesota is dental therapists are working in rural communities. They are going where they are needed.
I did something in Alaska that all my Alaskan dentist friends have never done. My dad wanted to go fishing in Alaska. So me, Dad, Brother Paul flew into Fairbanks. We drove down to Homer, went halibut fishing for a few days. Then we were on the Kenai Peninsula, went salmon fishing. It was during the king salmon run, so it was like, I think it's like June or July or something like that. Anyway, we got all done, and we decided that we wanted to go see the Arctic Ocean. So we drove up to Mount McKinley, and then I think I forgot the most northern Fairbanks, then the last big city with a highway. And we're sitting at the Waffle House, and we said, well, we want to drive to Prudhoe Bay. And the guy starts laughing. He goes, you can't drive to Prudhoe Bay. He says the only road is the Alaskan Pipeline access road, and it's private property. And me and Dad looked at him and said, well, what happens if we drive the Alaskan Pipeline access road to Prudhoe Bay? He said, I mean, are we going to get arrested or a ticket? Or he goes, dude, I've only seen a sheriff on that road once a year. And so me, Dad, and Paul drove from that northernmost city all the way to Prudhoe Bay. And when we went over Brooks Range and saw the reindeer herd of like 25, I mean, when we pulled up into Prudhoe Bay, those guys were laughing so hard because we were so dumb. We assumed there'd be a Holiday Inn there, a Hilton, a Waffle House. And they called us Lower 48. They felt so sorry for how dumb we were. And we were on a once-in-a-lifetime vacation that they let us sleep in their barracks. They refueled our car for free, filled up we had like five-gallon gas cans in the back of the SUV. They took really good care of us. But that was an amazing trip. But, do you remember Jack Dillenberg when he was dean of the ATC?
I know Jack very well.
Well, he was telling everybody that 10 years ago. He's like, look, you're not going to accept a kid from Phoenix, Arizona, and then he's going to go back and practice the rest of his life on the Navajo Indian Reservation. If you want dentists on the Navajo Indian Reservation, you got to accept Navajos. And he understood more than anybody the holistic nature that if you want, 25% of Arizona's Indian reservations, and he set out full speed ahead to start getting rural kids, reservation kids, to spread these dentists out, and everybody called him a quack.
So, Howard, let me tell you. So I've known Jack for a long time, and a lot of us were skeptical when he started that, and he proved us wrong. He proved us absolutely wrong, and I will be the first to admit that. His numbers of what his students do after graduation is very different than other dental schools, and he has sort of really figured it out. But again, I want to give credit. Other dental schools have been working on this issue for quite a while. I don't think we've had the success that Jack has had. But yeah, I agree with you 100%. He's done a wonderful job in Arizona, and I hope that they continue to do what they're doing at AT Still.
And when you accept a kid to UMKC Dental School from Kansas City, she's got to have the plaza and the shopping and the dining and all this stuff. But that girl that you accept from small town Kansas, that girl wants to be able to walk out in her backyard and shoot a rifle, and she wants her kids to be able to ride a mini bike when they're 5 down a country road, and they're just different people. And Jack understood that rural people don't want to live in Phoenix, Arizona. In fact, they hate it. They actually hate the big city.
One of my first trips for Kellogg a number of years ago was to go out to Kansas and meet with folks talking about dental therapy out there. And I remember flying in and having to drive across the state. And the first impression I got was I'm in the middle of nowhere. All right. And I went to, I forget the name of the university, but it was at the far end of the state. And I met with folks who were saying exactly what you were saying. We have needs in rural Kansas that are different than in other areas, but it's the same problem in Minnesota. It's the same problem in Florida. We all have little variations of that, but it's folks who will be willing to go back to those rural communities, folks who are interested in taking care of underserved patients, that we need more of those in dental school, and we need a system that promotes that.
Yeah, I remember it was so hard raising my 4 boys because in the summers I'd send them back to Kansas, go spend 2 weeks on Grandma's farm. Then they'd come back to Phoenix and they'd want to have the 22 rifles and the mini bikes and the motorcycles. And I'm like, dude, you can't go out there and shoot 22s in Phoenix, Arizona. We're all going to go to jail. And I question my I actually question the lifestyle. I mean, so many times with my 4 boys, I thought to myself, God, they would have been so much happier in rural America. But like I say, it's all the
there are pluses and minuses. I mean,
right.
You try to get the right balance for yourself and for your children. I mean, I lived in the middle of Manhattan for 1 year with 2 very small children, and my wife and I, when I was doing some work at Rockefeller University. We loved it, we enjoyed it, but we're glad to go back to somewhat rural Connecticut. Went back to my position at the university there. You have to find a balance.
So, just giving you a heads up, you're flying to where I'm at and live, Phoenix, Arizona, next Wednesday. And the Arizona State Dental Association is emailing all their members an alert to call your congressman for this hearing. They're trying to organize everybody to vote against it. You obviously probably know that that's what you're walking into. So what is your strategy when you talk to the legislators? What is your strategy when you talk to Kevin Earl, the executive director of the Arizona State Dental Association we've had on the show? Are you nervous about this, or you got butterflies in your stomach? What's that?
I'm not all nervous about it because I've been doing this for 10 years, okay? So the very first thing you have to say to the legislators is look at the evidence, look at the evidence, look at the evidence. When they tell you they oppose dental therapy, ask them to show you some data to support that. To be blunt, I have had conversations one-on-one, I wouldn't do this at a committee hearing, about the influence of PAC money. All right? Because we've got to face up to that reality. And what I know I'm going to face in Arizona is one organization opposing it and about 30 to 40 other organizations that are in support of dental therapy. And so I will talk quite frankly at the committee hearing with the history of dental therapy, the current research results coming out of Alaska and Minnesota. So no, I'm not concerned at all.
So Vermont, so Alaska and Minnesota are doing this. You said Minnesota's graduated 80 students, and Vermont and Maine have approved it. So I figure there's kids in classes now; they just haven't graduated yet.
So it takes some time to get a program started. So Vermont has hired a program director, a dentist, and they will probably accept their first class this fall. I'm actually going to be meeting her next week in Orlando, and we're going to have actually a panel discussion at the American Dental Education Association meeting next Saturday morning on the CODA accreditation requirements for dental therapy education.
Well, email her and CC me, Howard at Dentaltown, and tell her I want her to come on the show, and it'd be a great 1-2 punch. You followed by her.
Well, actually, what you want to get is you want to get someone. Her program hasn't started yet. You really want to get somebody from the Minnesota or Alaska program. Dr. Mary Willard is the director of the Alaskan program. She's been the director since the beginning of the program. She lives in, did live in rural Alaska. She now lives in Anchorage, where the program is.
She's a dentist, Dr. Mary Willard.
She's a dentist, Dr. Mary Willard. And then Dr. Carl Self, SELF, at the University of Minnesota, and Dr. Colleen Brickle at there are two different programs in Minnesota, one based in the dental school and one based in the hygiene program. I can send you those email addresses and names, Howard, and I think they would make great guests for you.
Oh, yeah. I mean, my show is doing so good because it's Dentistry Uncensored. I don't want to talk about what everyone agrees on. I mean, you said the research showed that 48% of the dentists are for it, 52% of the dentists are against it. That makes me want to do 10 shows on it because that's where the ball is. You know what I mean? That's where the action is. Just like I said in pediatric dentistry, the issue is silver diamine fluoride. I don't really think the endodontists even have an issue. The issue in oral surgery is that in countries like Germany and Austria and Liechtenstein, they only pull about a third of the wisdom teeth that Americans pull. Yep. American oral surgeons. Oral surgeons extract wisdom teeth simply because they exist. And the Germans and the Austrians, they like to look at research and they say a third of them don't cause a problem.
Yeah, so you're absolutely correct. The evidence does not support the mass removal of third molars, wisdom teeth, that we see in this country. And the oral surgery organizations have just avoided discussing that evidence.
Yeah, and I feel abused by that system. I feel abused by that system because, me and my 5 sisters don't have any tonsils or adenoids. Why? Because I was born in 62, and in the 60s and 70s, first time we got a sore throat, guess what they did?
Yep. Well, I was born in 44, and same thing. I'm of that generation. We don't have tonsils.
Yeah, and now the crazy one, I don't know if we should talk about this. They say you should never talk about religion, sex, politics, or violence, but now the circumcision issue is back up. And now there's a lot of people saying that that's a cultural thing. What is your view on that?
I don't think it's a cultural thing, but I don't know. I mean, it's what we do in this country for the most part, and it sounds like a reasonable thing to do.
Well, it looks like a lot of insurances are going to stop paying for it because they're saying.
Oh, I heard. That's interesting.
Yeah, a lot of the insurance are saying they're not paying for it anymore because there's no evidence that this removal of excess skin is an issue. But you're right. I don't think 2 dentists should be talking about circumcision. But it is an interesting thing how we're moving more to an evidence-based society, and I would like to see the oral surgeons really look. What I like is that the internet is really killing nationalism. I mean, like there's people listening to the show in all the countries, and the internet. A Google search. By the way, if you Google search your name, I really like that video, "The Future Now." Frank Catalanotto on YouTube.
Coming back out in June to Phoenix to speak to the state national organization that promoted that video. It's the Future of Dentistry Symposium. Dr. Mark Cooper.
Absolutely. He's been on the show twice.
Yeah, so I'm speaking to their DSOs, dental support organizations. This is a group of smaller DSOs, not the larger type DSOs, to talk to them about the value of dental therapy.
That is...
I'm really looking forward to that visit, although I'm not sure I want to be there in June because of the weather, but it's probably better than Florida in June.
It's funny. I born in Kansas, went to Creighton and Omaha and dental school in Kansas City, and, during the, you got to stay indoors when it's too damn cold, and in the summer here, you got to stay indoors when it's too damn hot. I cannot believe that one time I was missed my flight to go lecture because I went to the Sky Harbor Airport and it was 126, and the Boeing plane said based on their design they need the air to be under 118. So we had to sit there in the terminal for 4 hours.
That is not the weather delay I would expect.
Oh my God, yeah. And when you tell people that weather, and then and I've also left here in Phoenix to go lecture in Minneapolis, St. Paul. It happened
Yeah.
one time. It was in the 90s. When I left Phoenix, I got to Minneapolis, St. Paul. It was 100 degrees colder. I think it was
Yeah.
like 82 in Phoenix, and I forgot what it was, but it was minus temperature there. But I couldn't believe that I traveled down 100 degrees. Well, hey, I really, really admire you, mostly because most dentists don't want to stick their head up in anything controversial. They want to, it's just so much easier to go with the flow. And when people tell me they're a pioneer in dentistry, I tell them to turn around and show me how many arrows in their back. And
Yeah.
if you don't have any arrows in your back, you're not a pioneer. No one's tried to take you down. You never ruffled any feathers. You never tried to change the world. Gandhi's quote was the best. At first,
One of my friends said
can
to
you
me
text me
that
that Gandhi quote?
as I take this battle forward in Florida, which we are doing right now, I will need to get someone to stop my car in the morning. And so it's look. I have become a passionate supporter about the issue of access to care. The early part of my career, I was probably like most other dentists, even though I was in an academic career. I was doing my research, I was doing my practice, I was raising a family. And I started to figure this out after working in the town of San Elizario for 2 weeks when I was at the University of Texas in San Antonio, and starting to understand that there is a healthcare problem in this country. And what I've later learned, it's a healthcare crisis. It's not a problem, and it isn't just dental care. It's all healthcare, and we've got to fix it. And I want to be part of that solution.
Well, Gandhi said it best. First they ignore you, then they laugh at you, then they fight you, then you win. And that's, it's a lot of people don't realize that the biggest successes you've ever had is what's standing in your way the most. Like, for instance, I think the United States has an insane passport system. You can get a fake passport on eBay. You can go
Yeah.
get passports anywhere. But when you go to countries that now started a passport system, but they didn't have the passport bureaucracy, you go there and you put your hand on an iPad and then your other
Yep.
hand on the iPad. Then you look in the deal and then it pulls up a picture of
You know what
me
to do.
and it says Howard Farran. I'm like, yeah, that's a hell of a lot smarter system. And you're supposedly a third world country, but that third world country doesn't have a legacy system that has support, like 911. I mean, it's crazy. The last time I called 911, she's asking me for a description of the car wreck scene, and I'm like, I can FaceTime my 80-year-old mother. Why can't
Yeah.
I FaceTime 911? Because they built a system a gazillion years ago and they'll be supporting it. And what's embarrassing is a lot of these government legacy systems, the only reason they upgrade them is because no one makes the parts for them anymore. So they finally have to upgrade because they can't get any spare parts. So, but anyway, that was the fastest hour ever. Thank you so much for coming on the show and talking about such a controversial issue. And best of luck. And I sure hope you introduce me via email to
I will.
the people from Alaska and Minnesota to talk about this. And I hope you have a rocking, hot, fun time when you come here at Phoenix, Arizona.